So I'm Dr. Larry Burton, and I'd like to visit with you a little bit about ear tubes. Both children and adults, when they get ear infections, there's that pain, there's that pressure, they're up at night, and the hearing is down. You don't hear really everything you need to be hearing, and plus you're suffering all that pain and pressure as well. So when someone comes in wondering why they have so many ear infections, what we can do about it, we'll often do a hearing test. We'll talk to people about their symptoms. We'll figure out what's bothering them, how frequently, how severe, and then we'll sit down and talk about some options, one of which may be ear tubes. So the healthy ear on the underside of the eardrum that we call the middle ear has air in it. It gets there from the back of the nose. There's this little thing called the eustachian tube, a little conduit between the nose and the ear. And when we yawn and when we swallow, it's pulled open for a split second, and air from the nose tracks up that eustachian tube and gets to the underside of the ear. But anything that causes swelling of that eustachian tube, head colds, or if you're a child and so you're small to begin with, if it pinches that off, then you get fluid underneath the eardrum, and then viruses and bacteria grow in the fluid, and now you got an ear infection. So with recurrent ear infections or ear infections that just won't clear, you come in seeking relief, and that's exactly what ear tubes can give you. Ear tubes are very small, flanged pieces of plastic. They sit in the eardrum. They keep a pinhole open. That allows any fluid to be drained out of the ear, and that allows air to go through the ear tube to the underside of the eardrum. So air behind the eardrum, no more fluid, no more viruses and bacteria, and you don't have ear infections anymore. So in adults, we place the ear tubes right here in the office. We just lean you back, numb up the eardrum, put the ear tube in, and you walk out the door hearing better and the pressure's gone. It's instantaneous. In kids, you still have to be still. So we take them to a hospital or a surgery center setting, about 10 minutes of being asleep. There are no IVs, there's no breathing tubes, just a gas mask anesthetic for about 10 minutes. Kids get back to their parents. 15, 20, maybe 30 minutes of fussiness, but by the time you're in the car, ready to go home, it's almost like nothing happened. They're ready to go about their day. You no longer need oral antibiotics. You no longer get the pain. You no longer get the pressure. And the question we'll often get is, well, once ear tubes are placed, are you never going to get an ear infection again? Occasionally you'll get a breakthrough infection, but it presents so differently. It's painless drainage. Then you call us up, and we'll put the child on some ear drops, and it clears the infection. But for the most part, once the tubes are placed, we don't even get those calls anymore. They last somewhere around 6 months to 2 years, about a year on average. The eardrum slowly grows over the backside, in so doing healing itself, but they come out on their own. The number of parents who come in saying, oh my gosh, my child is feeling so much better. For those who truly can benefit from ear tubes, it makes a huge difference. It breaks the cycle of recurrent ear infections. It stops the need for recurrent oral antibiotics. But most importantly, it stops that pressure and that pain and the sleepless nights and the hearing loss that's associated with ear infections. Please reach out at any time as you're considering ear tubes. We'd love to help.